The AOA, for some years now, has been engaged in a national campaign of consumer awareness focused on the specific role that optometrists play in the eye health of Americans and in their general health as well. What you just saw was a sampling of the media exposure that was given to the AOA last year. Back in May, in the context of the 3D movies being released that summer, we issued a campaign in conjunction with Hill & Knowlton, our PR consultant, to educate Americans about the fact that millions of them may be unable to enjoy the 3D movie they're about to buy that ticket for in the summer of 2010. And it clearly generated quite a bit of activity, close to 500 million media impressions. In fact, that momentum has continued into 2011 with just in the past 2 months alone, primarily because of the announcement from Nintendo, a warning, we suspect primarily triggered by advice from their counsel, implying, not so much implying, out saying that for children under 6, their vision development could be in some way compromised. Well, we as the experts in eye care know there is no facts to support that statement. In fact, we believe that the release of the Nintendo game 3DS in a couple of weeks is a blessing in disguise in that it will create a teachable moment with the American public, and specifically parents of children that have this technology, that if their child experiences symptoms, don't you think it's time for an eye exam? And that's what the theme of this collaboration is all about. Because back last year, in the effort we made with the media, we had Dr. Lenny Press, practices in New Jersey, Dr. Dominic Mano, practicing in Illinois, members of the AOA, and also active in the College of Vision Development, to express this call to action. This is a time for us to reinforce the importance of eye care. And it fits quite nicely with the overall mission of the AOA, which is to improve our members' success as doctors, both as clinicians and as folks running businesses and wanting to maximize the access of patients to their practices. Thanks, Marge, for your acknowledgement of our event. Obviously, we appreciate the opportunity to be here today, but it's great to have the engagement of the ophthalmic press and a leader like Vision Monday in the release of a press announcement yesterday, which was acknowledged by my colleague Chris. We think it's historic in its importance, where the doctors in eye care are aligning with the technology experts in 3D. That's a powerful, powerful collaboration, we feel. In fact, in the time that we have been working together, to give you an example, just the symposium we did yesterday, that was a 30-day timeline. 60-day timeline for the development of the Memorandum of Understanding, which, as you see in the slide, is about sharing scientific information, clinical research, so we all have a better understanding of the 3D viewing and its relationship to vision health. We think a very significant development in the history of eye care. And it relates very directly to this slide. And this slide shows a new way of thinking about the public accessing the services of optometrists and the products and services represented by the attendees here today. Currently, when you consider the situation with children, fewer than 2 out of 5 children before they enter school have a comprehensive eye exam. So what is this country, and I kind of emphasize this country because this is not the way it's in the rest of the developed world. What is the situation in this country? We rely on school vision screenings that have something in the neighborhood of 27% sensitivity. That means 3 out of 4 times the school, whoever's doing the screening, is telling the child, the parent, with a problem, that child has a problem, 3 out of 4 times when a problem exists, they are falsely being reassured that there's no problem. So think of the numbers, we think millions of children who are victims to false reassurance because they have a problem that's affecting their vision, their learning, their school performance, and yet they're being told, you passed the vision screening. So clearly the gold standard is the comprehensive eye exam. From our standpoint, we've made it clear in the policy world that we believe every child should have a comprehensive eye exam before entering school. In fact, we believe every infant in America should have an assessment within the first year of life. Why wait? We're dealing with preventable conditions. And as you know, from the good work that the Foundation for Eye Health Awareness has been doing and Think About Your Eyes campaign, we know that on the adult side, 30 million Americans at risk of vision loss in this country last year should have gotten an eye exam and did not. So we have a huge problem in this country with barriers to access. And the barrier to access primarily is people not believing that they have a need to go and get that comprehensive eye exam. In this prevention model, this is interesting, 3D vision experience being a preventive model. Well, the simple experience of asking someone if they can appreciate stereopsis, it has a 42% sensitivity. In other words, just the experience of 3D vision for a second, literally second, will recognize 50% of the time when there's a vision problem. You add it with other aspects of risk identification, and you increase the specificity to 94%. So in our view, the blessing in disguise, as 3D technology becomes more accessible, more ubiquitous in society, we're going to have folks that have symptoms. And if we are properly positioned to create teachable moments, for example, one of the things we're looking at through the consortium collaboration with AOA is, why not a PSA in the theater? When you sit down in the theater, it reminds them, if you're not enjoying this film, maybe it's time for that comprehensive eye exam. Go to www.aoa.org and find an optometrist that will take care of you. Or maybe when you buy your 3D TV, or you buy your 3D glasses. These are all issues that we explored yesterday in what may become an annual event. It was phenomenally successful yesterday. We are very fortunate that SUNY College of Optometry played the host to a symposium on 3D vision and health. We explored the public health implications. That slide I showed just a minute ago, aspects of the visual system and the user experience and the industry response to public health needs. And we shared a bit about the specifics of this collaboration between the leading association of technology and content producers in the country for 3D materials and the AOA, which is the leading association of optometrists. What we did in that conference, again, at SUNY, a very appropriate place because it's a center of excellence in teaching and research and patient care. It was supported by Marchon 3D. Very thankful to them. And if you have not been downstairs at this event, please do so and see their display. But it was very successful. Successful for us meant that we believe we got the message out about this blessing in disguise. We had representatives from ABC, CBS, Turner Broadcasting, HTV, TV, JCV to Samsung. We had videographers. We had cinema architects. We had quite a dispersed, diffuse group of leaders, we believe. And it marked the beginning of our enterprise. I'm pleased Dr. Joe Ellis, the president of the AOA, was able to be there and officially preside over the execution of our Memorandum of Understanding. We think there's going to be a lot more about it. You want to learn more about this symposium and the ongoing development of this collaboration, go to 3dihealth.org. 3dihealth.org. It's a collaborative website of the AOA and the consortium. You're all familiar with Clayton Christensen's concept of disruptive technology, and we're always looking Are we experiencing in something new in the marketplace a disruptive innovation that improves a product and service in a way that we don't expect? I think we are clearly at the threshold of a disruptive technology. And the question for us here is what we're going to do about it. We at the AOA, representing the doctors on the front line of eye care, know that 3D technology is a disruptive innovation for healthcare and for society at large. We think it's going to change the way people think about the quality of their vision and motivate them for more prompt and more likely periodic eye care. So it's time for all of us to put 3D glasses on and look to the future for the profession and the eye care industry. So this is the effect I hope you get by the remarks we made today, and that you're giving thought to what the opportunities are. And that's where we're going to leave it at this point into a question period. Because if you think about the obvious implications are, well, and just an anecdote, my wife and I went to Best Buy the other day to look at 3D televisions, and I was trying to compare them, and when she put on the first pair of active glasses, I'm enjoying the film. She put them down immediately, and I said, "What's the matter? Don't you like the film?" She says, "The film, the glasses don't fit." I mean, the reaction was that was part of the experience. And so there's great opportunity for developing new products, embedding RXs in these glasses. What's going to happen to the contact lens industry? What's going to happen to those patients that you prescribe monovision for? And now they're not going to be able to enjoy 3D movies because all of a sudden you've corrected them at near for one eye and distance for the other eye. So that's what we want to explore right now, the opportunities. What is the next exit? We think we have a game plan here between AOA and our members, but we think it's important to involve everyone in this conversation. And we at AOA and the 3D at Home Consortium look forward to working with the ophthalmic industry to find a way to look to that silver lining in this issue about 3D vision. So I think we're going to go into questions, so thanks for your attention.